Naturalhealthcare.ca, Canada's guide to complementary and alternative healthcare.
Do 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 do. Do 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. Today, we're going to be talking about staying healthy in the cold and flu season. But before we get to that, we're going to see what JJ's taking today.
Okay, today I'm taking a immune combo. I don't like to use the word immune boost. It's not very scientific, so I usually call it immune combo. So it's a mix of different herbs, which we'll talk about, and different supplements that help support your immune system when you're trying to fight an infection.
Are you fighting a cold right now?
My throat's a little bit scratchy, so
Yes.
I'm just going to take one just to be on the safe side. You have to bear in mind, I work at 2 hospitals. I see a lot of patients. So during the winter season, I will be exposed to a lot of sick people. So I usually find maybe every 2 weeks or so, I'll take something just preventatively.
And so that has some echinacea and astragalus in that with it, or no? Or-
Astragalus, a lot of the stuff I'll talk about in a little bit. There's
Awesome.
all in there. Astragalus, echinacea, berberine, vitamin C, baptista, all these things I'll talk about. So
We typically take echinacea and astragalus as a sort of first line.
Astragalus, yeah.
Astragalus.
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 It's a different word. Where am I getting?
We usually take it in the drop format, though. Does it matter if it's drops or the capsule?
No, not really. It could either be, so the drop format, what Jen is referring to, is it's an alcoholic tincture. So what they do is that they'll take the herb or the root, etc., and they'll put in an alcohol tincture and they'll extract all the chemical ingredients. I don't often give a lot of tinctures just because I find the taste is a bit prohibitive for some people. They don't, the taste can be a bit less than palatable. So I usually just give it as capsules. Also with kids too, I'm a bit careful giving them alcohol. They don't usually like to do that, so I just give it as capsules.
The kids can't take capsules.
That's true, but
So that's
sometimes you
what
can
we
get chewable ones,
Yes,
or you
there
could
is
get
one.
syrup ones, or you could get non-alcohol based ones too. So,
Perfect. So what exactly is the difference between a cold and a flu?
okay. A flu is a viral infection, and a cold is also a viral infection, but the symptoms are different. You diagnose them differently. So, in the case of a flu, normally you'll have a fever, you'll have malaise, which means you just feel bad. You'll often have joint pain and muscle pain. You'll usually be incapacitated. Whereas in a cold, it's a milder form. There's rarely a fever in a cold. There could be a slight fever, but usually there's not a fever in a cold. You could have runny nose. You're not going to feel as bad as you feel in a flu. So those are the main distinguishing elements between a cold and a flu.
Okay. And they always promote taking a flu shot.
Flu shot. Yep.
Is it really necessary, or is there a more natural approach that you could take?
Yeah, there's definitely a more natural approach. At the hospital, it's routinely given to all staff. So I see the carts coming around every year. I don't personally take the flu shot. I don't really view myself as a population at risk. For the elderly, I would recommend the flu shot. For example, my mom takes the flu shot. And for children, they recommend them at risk. That's a bit of a controversial debate. So that's really up to the parents if they want to give their kids flu shots or not. So in the general adult population, it depends. It's on a case by case basis. It's a bit of an interesting one. So I kind of sit on the fence. But based on my answer, the fact that I don't take it should pretty much insinuate how I feel about giving adults the flu shot that are not seniors. So
My family, we actually take a homeopathic version of the flu shot. Is that just as effective as the...
some people have used it. I don't use it personally. I just work on treating my immune system. But there are some products out there. They have long Latin names, oxycococcinum or muculococcinum. They're both made in France. And the idea is that they take homeopathic dilutions of viruses, similar to the vaccine. They take viruses from previous years, and then they put in a homeopathic, and they give it to people, and you're supposed to inoculate yourself, quote unquote. Homeopathy is a bit of a controversial one. So some of the studies claim it's a placebo. Some studies have shown benefit. It's a bit of it's kind of a head-to-head battle on that topic. But some people swear by it, and they say it works really well.
So what are some strategies of what people can do to help prevent catching a cold and getting the flu?
Definitely there's some personal hygiene. You want to try to wash your hands as much as you can. Because I work in a doctor's office in a hospital, I'm very conscious when I eat or rub my eyes. I always make sure I clean my hands first. Now when you sneeze, in the past, you go, oh, excuse me, because you thought, etc. You don't sneeze in your hands anymore because what we found is that you actually will spray a lot of not mucus, but a little bit of mucus, but really a lot of airborne particles into your hands. So what you do now is you sneeze into your elbow crease, and you go, oh, so basically it just gets all absorbed into your clothes. That's a better way of trapping stuff there. That's a good way. In terms of prevention, vitamin C, the studies have been mixed. Also, the studies have been mixed with echinacea in terms of them being able to prevent the cold or the flu. But I've found vitamin C to be very beneficial. The trick with the natural health products I'm about to suggest for treating the cold and flu is you have to take them as soon as you see symptoms. So as soon as you start to feel a bit run down, your throat is scratchy, you feel a bit sweaty, as if a fever is coming on, like you normally know when something's coming on, take it right away. If you wait until it's full-blown, it takes a lot longer for your body to recover because a lot of it becomes hydraulics after a certain point. It's just plumbing. Once you get an infection, it sets into your sinuses or your nasal passages, and it's just hard to drain it out. So you have to go through the whole motion. But whenever I feel any symptoms coming on, usually what I'll take, and I'll give you the list, astragalus, I'll take ginseng. There's two very good forms of ginseng that have been shown to help stimulate your immune system. There's Panax ginseng, which is Korean ginseng, and also there's American ginseng, which some of you may know as the product Cold Effects, so that works very well. Garlic, very good. Berberine, which comes from barberry and Oregon grape, and golden seal. These are all great products. Also Baptista is very good for any type of lung infections. Echinacea I'll usually put into a combo, and vitamin C. So usually I don't take one of these in isolation. I like the whole ensemble of their different immune effects. So when I take those.
But I think it's also important if you do get to the point where you have let it go too long and you do feel it come on full blast. I know we see our naturopath and she comes up with a combination that fits the exact symptoms that we're experiencing. So a combination of the botanicals and the vitamin C and homeopathics as well.
Yeah. And also diet-wise too, you want to minimize your mucus-forming foods.
Oh, yes.
Wheat and dairy tend to be more mucus-forming foods. And as I mentioned, once the infection sets in, it's really more of a hydraulic, more of a plumbing issue. So if you make more mucus, you're adding more mucus to the existing mucus overload. So you try to avoid those. Also, sugar will depress your immune system when you have an infection, so nothing sweet. Also, no alcohol. And drink a lot of water, particularly when you have a runny nose. So you want to flush it out. So that's very important. So
I've also seen the neti pots and the inhalers for salts. Yeah,
those are good too. Those are good for prevention too. Those work really well. And also, if there's a fever. The old wives' tale rule of starve a fever, feed a cold. Definitely, I've seen that personally and in patients. Usually, you definitely want to stay hydrated. Very important to stay hydrated. But when you have a fever, you want to eat less than usual, whereas a cold, you don't see that big of a difference. And often flus, what we find too, is even if you eat too much, you tend to repeat it and vomit. So be careful with that.
What about chicken soup?
Chicken soup is great. It tastes good. Provides you with some electrolytes. Provides you with some nutrients. So definitely, that there's a good comfort too. And then you just go and you sleep and you feel warm because you have a bowl of chicken soup in your tummy.
Perfect.
Yeah.
Awesome. Well, thank you very much for those tips on how we can stay healthy through this cold and flu season. I hope you have learned something today. If you need to find a naturopathic doctor to help you find something that's going to suit your personal needs, you can go to our website, www.vitamin